Come in.
Hi, are you Jackson?
Yes.
I'm Sarah Walsh. I'm a PA student. I'll be taking care of you today. Nice
Hi.
to meet you.
Nice to meet you.
Can you just verify your name and date of birth for me?
July 19th, 2001, and my name is Jackson Ellers.
All right. Are you comfortable with me taking care of you today?
Yes.
Okay. Can you just tell me what brought you in today?
So I was riding my skateboard at a pretty fast pace, and I hit a curb, and I fell off, and then my arm hurts really bad right here.
Okay. And when did you fall off your skateboard?
Like an hour ago.
An hour ago? Okay. And can you point on your arm where it was hurting again?
It's like right here.
Right there?
Mm-hmm.
Does the pain stay there, or does it move anywhere else?
It goes like up and down my whole arm when I move my arm.
When you move your arm? Is there anything that you do that makes it feel better?
If I kind of hold it.
If you kind of hold it? Okay. Is there anything else that makes it feel worse?
Moving it a lot.
Just moving it a lot? Okay.
Yeah.
Okay, and can you tell me what the pain feels like? Is it dull? Is it achy? Or is it really sharp, like you feel like there's knives going through you?
It's really sharp.
Really sharp? Okay. Okay. And then, so you fell off about an hour ago. Has it been just hitting or hurting continuously throughout the whole hour? Or has it gotten worse as time goes on?
It's gotten a little bit better since it first happened, but it still hurts pretty bad.
Okay. And is there anything else that you're feeling today that you would like to share with me? Like any other symptoms, like headaches, anything like that?
No.
No? Okay. And then, is there any reason why you think you might have fallen off your skateboard today?
I was probably just going too fast.
Just going too fast? Okay.
Mm-hmm.
All right, we're going to go through a little bit of your medical history now. Have you ever had any childhood illnesses like chickenpox, measles, or mumps?
I had pneumonia when I was 7.
Pneumonia when you were 7? Okay. Have you ever had any illnesses while you're an adult? So that could also be like chickenpox, measles, or mumps type thing?
No.
Okay. And then do you have any active medical conditions? So like maybe osteoporosis or any of those kind of diseases?
No.
No? Okay. Do you take any medications right now? So that could be like something that a doctor's prescribed to you or something you buy at CVS over the counter?
No.
And then that's like vitamins, supplements, anything like herbal stuff like that?
No.
None of that? Okay. All right. And then do you have any allergies to anything?
I'm allergic to peanut oil.
Peanut oil? And then what happens when you have peanut oil?
I get hives and my throat gets tight.
Okay. But no allergies to medication?
No.
Just the peanut oil? Okay. All right. So we're going to go through a little bit more about yourself. So who do you live with right now?
I live with my parents and my 4 younger siblings.
And 4 younger siblings. How old are your siblings?
15, 13, 10, and 9.
Okay. And then they all live with you, and then you all live in a house? Do you live or like in a condo or an apartment?
A house.
House, okay. And then are you currently enrolled in school?
Yes.
And then do you have a job, or are you just a student?
I work at a diner.
You work at a diner? Okay. Have you ever drank alcohol or used any illicit drugs like cocaine, meth, heroin?
No.
Have you ever smoked marijuana, ingested it, or drank it? Any other ways of taking it in?
No.
Okay. Do you have any previous history of tobacco use? So that, like, chewing tobacco, smoking cigarettes, anything like that?
No.
Okay. Okay. Have you recently traveled outside of the United States?
No.
Have you traveled within the United States anywhere?
No.
No? Okay. then do you have any history of bleeding disorders or clotting disorders in your family?
Not that I'm aware of.
Okay. And then do you have any history of diabetes yourself?
No.
All right, I'm going to go through a couple more symptoms with you just to make sure that we're all good on the same page and getting the whole picture with you. So do you have any headaches, changes in your vision, or changes in your hearing, like ringing in your ears at all since the fall?
I have a headache a little
I
bit.
have a headache? Okay.
It's not bad though.
Okay, so it's not bad. What does the headache feel like? Is it like a sharp pounding pain?
It's just kind of dull.
Dull? Okay. Do you have any pain in any of your other joints? So like your shoulder joint, your wrist, your hips, knees, ankles?
This wrist hurts a little bit.
Your wrist hurts a little bit on your right side?
Yeah.
Okay, do you have any chest pain right now, or do you feel like you're kind of short of breath at all?
No.
Okay. Have you had any fevers, chills, nausea, anything like that?
No.
Do you have any abdominal pain or tenderness, like when you touch it, like anywhere around here?
No.
Okay. Are you peeing and pooping okay?
Mhm.
Okay. Do you have any muscle aches or tightnesses in any of your other muscles right now?
No.
No. Okay. Have you been experiencing any trouble with your talking or speech since the fall, especially?
No.
Nope. Okay. And then, do you have any rashes or cuts or scrapes from your fall?
Well, my hand's pretty scraped up.
Your hand's pretty scraped up.
Mhm.
Did you lay on your hand when you fell?
Yeah.
Okay. All right, well, I'm going to go ahead and bring this out to your doctor. It was nice meeting you. Hopefully we can get everything sorted out.
Thank you.
You're welcome. The patient today is Jackson Ellers. He's a 17-year-old male student who works at a diner, and he lives with his parents and 4 siblings. Today he presents with left arm pain after falling from his skateboard from a curb and landing on his hand at high speed, which happened about an hour ago. He has no active medical conditions, and he has denied a history of current bleeding and clotting disorders and does not have diabetes. But the patient did have pneumonia when he was 7 and has no current adult diseases or past adult diseases. His arm pain started after the fall and has lasted the duration of the hour until the visit, with slight improvement over time. He believes he fell off because he was just going too fast. Patient describes the arm pain as sharp and located on the left forearm. Moving the arm makes the pain worse, and holding the arm inferiorly alleviates the pain. The pain radiates to the whole arm when he moves it, otherwise it stays in the same place. There are no associated symptoms with the arm pain. He states that he hasn't had this type of injury before, and this is a first-time account. He denies any family history of disease, and he is currently not taking any medications, both prescribed and over-the-counter. He is allergic to peanut oil, and he gets hives and a tight throat when he ingests peanut oil. He has no history of alcohol use, tobacco use, marijuana, illicit drug use, and he has not traveled recently within the United States or outside the United States. He has a little bit of a dull headache, but no vision or hearing changes. He has ipsilateral wrist, hurts a little bit, but no other joints above or below hurt. He denies chest pain, tightness in chest, and shortness of breath, no fevers or chills, no abdominal pain or tenderness. His urination and bowel movements are normal, and he has no muscle aches or tightness. He has no changes in speech, and his left hand has several scrapes from falling.